My name is Jennifer. Thanks for coming in today. What brings you in today?
My doctor told me I needed a swallowing evaluation.
All right. I'm going to tell you a little bit about a swallowing evaluation. I'm going to check the movement and structures of your throat. We will swallow different textured foods. All right. I'm going to ask you a few questions. They may sound silly, but where are you at right now?
My house.
Okay. And what time is it?
8:10.
Okay. And why are you here?
Because the doctor told me to.
All right. Now, have you ever had any concerns about swallowing?
No.
Have you been hospitalized for swallowing?
No.
How about any treatment for speech or language?
No.
Do you have diabetes?
No.
Any food allergies?
No.
Are you currently taking any meds?
No.
Okay. Have you ever had any of the following? Pneumonia?
No.
Tracheotomy?
No.
Do you use oxygen?
No.
Okay. I'm going to have you do a few movements. I want you to raise your eyebrows. Nice. Now, I'm going to have you close your lips. Very good. Pucker your lips. Nice. Now, I want you to smile. Show me your teeth. Very nice. Next thing, I want you to bite your lower lip. Perfect. I'm going to have you say ooh-ee 5 times as quick as you can.
Ooh-ee, 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 ooh-ee.
Alrighty. I now want you to puff your cheeks with air. Alright. I'm going to have you close your lips. Seal them up as tight as you can. And I'm going to try to open them with my hands, but I don't want you to let me open them. Just put gloves. Alright. It's a doozy. My fingernails are pretty long.
Tons of fun right after the sanitizer.
Exactly. I thought it was dry. Alright, go ahead and close your lips. I'm going to try to open them. Alright, try one more time. Very good. Alright, next I'm going to have you stick out your tongue. Perfect. Lift your tongue up. Now I want you to open your jaw. Now say la 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 3 times.
La 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 la.
Now I want you to lift your tongue to the roof of your mouth and scrape back like this. Alright. Next I'm going to have you stick your tongue on the side of your cheek and push against my finger. Start on this side. Perfect. And this side. Perfect. Next, I want you to stick out your tongue and put it in the left and right corner of your mouth. Very nice. Now, I'm going to use a tongue depressor. Okay. And what I want you to do is push your tongue against the tongue depressor. Okay, perfect. Now I want you to stick out your jaw. Now pull it back. Now to the left and to the right. Alright, next I'm going to look in your mouth. I'm just going to look at your teeth. Okay, open. Alright. The top 12. And on the bottom 12. Alright. Now I want you to bite down. Okay. Very nice. Last one occlusion. And put your head down just a little. And another class 1 occlusion. Perfect. Next I'm going to look at your hard palate. Nice. And I'm going to look in your nose. Very good. Alright, next I want you to say ah. Very good. And I'm going to have you hold your breath. I'm going to count to 5 and then you can stop. Go. 1, 2, 3, 4, 5. Very nice. Now I want you to cough loud. All right. Now I want want you to clear your throat. All right, next, I'm going to have you say pa, 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 as quick as you can.
Pa, 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 pa.
Next, ta, 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 as quick as you can.
Ta, 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 ta.
And ka, ka, ka.
Ka, 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 ka.
Now we're going to put them all together, and I want it to be patika as quick as you can.
Patika, 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 patika.
Very nice. Next, we're going to get out some foods. I will be touching your throat. Okay, so the first thing I want you to do is I want you to gather up some saliva in your mouth. Okay, don't swallow it until I tell you. I'm going to put my fingers on your throat. Okay, go ahead and swallow. All right, very nice. Okay, next we're going to eat some applesauce or swallow some applesauce. All right. One second. Okay. Now I want you to swallow this, but not until I tell you to. All right. Go ahead. Swallow. All right. Check and make sure it all went down. Open it. Stick out your tongue. Okay, perfect. All right, do this just 2 more times. Okay, don't swallow until I tell you. All right, go ahead and swallow. All right, make sure none's left over. All right, perfect. 1 more time. All right, hold it in there. Go ahead and swallow. All right, 1 more check. All right, all gone. Okay, next I'm going to have you take a bite of the cracker. All right. I want you to take 2 to 3 bites. All right, hold it in your mouth until I tell you to swallow. Just chew it up. All right. Go ahead and swallow. All right. How did that go down?
Good.
All right, let me make sure. All right, 1 more swallow. There's still a little left in there. All right. Next, sip of water. Okay. Next, I'm going to have you take a little teaspoon of water. Again, I want you to hold it in your mouth until I tell you to swallow. All right. Go ahead and swallow. All right. Perfect. All right. Next, you're going to just take a small sip of water. Make sure it's all gone. Oh yeah, under the tongue. Good job. Next, you're going to take a small sip of water and hold it in there. All right, go ahead and swallow. All right, let me check, make sure it all went down. Lift up the tongue. All right, nice job. Next, you're going to take a larger sip of water. All right, go ahead and swallow. All right, let me check and make sure that all went down. All righty, perfect. Next thing, go ahead and we're going to put the straw in the water. You're going to take a sip, hold it in your mouth until I tell you to swallow. All right, go ahead. All right, let me check. All right, everything went down. Very nice. After I looked at everything, you have a normal swallow response. It looks like you have adequate range of motion in all areas. And if you have any swallowing concerns in the future, come back and see us.
Will do. Thank you.
You're welcome.